Hello, afternoon.
Hey everyone.
So we'll just give it a couple of minutes for people to join. We are on the hour. We'll give it a minute or two. Okay, I think we've got a couple of people who have joined. Yep, we're around the 34 mark. Think we're safe to make a start. So welcome today to our webinar on medication delivery and collection. That's our new feature in Medibase. And today we'll go through from consultation all the way through to the first dose and prescription that patients will be taking away from prescriptions that are prescribed in the feature. So quick agenda for today, we'll have a bit of an intro, hopefully get some of you at home and in the office or in the clinic involved. Then we'll be going through a little bit about Medibase and a little bit about Signature RX if you aren't familiar with either. We'll go through integration benefits of our feature, client success stories, and then we're hoping to give you a demo today as well so you can see the functionality in action. We absolutely encourage questions, so please pop them in the chat. A couple of you have said hi in the chat, so welcome to everyone. Also got someone from the US, so great, nice to have you, Jay. But any questions that you have, pop them in the chat, and then at the end, we'll spare a couple of minutes to go through those. We've got about 40 minutes scheduled today. We're likely to go slightly over, but we can see how we go, and this session is being recorded. So anyone that wasn't able to make it, or if you have to drop off, then we can share that recording with you to view later. So to kick us off today, I'd like to invite you all to join some Slido questions that we've got set up. For those of you that have used Slido before, brilliant. If you haven't, it's quite simple. If you've got a mobile device, you can join by scanning that QR code. Otherwise, if you're on a desktop, you can go to slido.com and put in that unique code. We've got a couple of questions just to get you all involved and start thinking about e-prescribing, I hope. So first up, we've got a question around, do you currently have a solution for e-prescriptions? So if you could just pop your answer on there using the QR code or the code in your browser, then we can see who already has a solution for e-prescriptions. So we're getting a couple of answers in there. It looks like the majority of people do not have an e-prescription solution, which is probably a good thing since you're joining a webinar around an e-prescription solution. And a small proportion that already do. That's great. Okay, well, let's pop over to the next question. So how important is it for your business to have an e-prescribing solution?
I think in the comments, well, if you kind of mention what you're looking for in e-prescribing solutions, well, we can kind of talk through that during the webinar and answer that question when we get to Q&As as well.
So ranking quite highly here, the importance of having an e-prescribing solution.
And I think there's like a wider conversation to be had here. You know, even if you don't think it's the most important thing for you now, if you look at the compliance benefits and the general CQC requirements, you'd actually see it's quite highly weighted. You know, just from a CQC point of view, we've had previous or even current CQC inspectors who have their own private practices using Signature RX and actually say that they use it because of the patient safety outcome. So even if you think, oh, the patient's here next to me, I can just print a prescription and hand sign it, there's definitely an auditability and a better compliance perspective by using prescriptions in that section too, where you may not have thought it's essential. There's definitely benefit to it.
And would you say, Reese, like post-COVID, I suppose, I think COVID's going to be mentioned a couple of times during this webinar, but do you see there's been quite a drive to having e-prescribing solutions just because of telemedicine and things like that?
Yeah, exactly. So especially when the patient's not physically with you, e-prescribing, that's when you're going to see it being more of an essential component of your business. We can touch on the admin side of that later and the compliance side, but it's so admin intense to have doctors working remotely or patients remote and having to post those scripts out and organize it with local pharmacies. So that's more of we'd say more essential, but now we're starting to return to in-person clinic. There's still a demand for it. So I'm sure everyone's seen a shift in remote prescribing, but then also kind of the lift up now in like in-person prescribing, where there's also benefit.
Yeah, great. And I think there's probably that I know that there's quite a difference, I think, with telemedicine based on specialism. It'd be
Yeah,
great actually if a couple of you, I know you've been active on the chat, but if you could share with us what your specialisms are, because that'd be quite a nice talking point maybe for later on in our webinar. But
yeah,
let's
that
pop
would
to
be.
our third and final question on Slido. So here, just trying to find a little bit more out about challenges that people are facing in clinic and in your organizations around patient data and medication data and how you handle that. And this feeds into, Reese, I think, some of those points that you mentioned already around compliance and things like that.
Yeah.
Right, looks like we've got a bit of a split. So I know that when we'll come on later talking around the client success stories, we absolutely find that a lot of our larger clients are focused on that governance and compliance piece for e-prescribing, because although we've had things like EPS around for a little while in the NHS in the UK, we haven't really had a market leader in the e-prescribing space for private practice. Would you agree, Reese?
Yeah, 100%. And I think also like a key point is there's also an increase in private prescribing, like awareness in general of private prescribing, going to private GPs. I feel like people nowadays are a lot more conscious about their health. They understand that NHS waiting lists are long, and private prescribers are, in a really good position to be able to assist patients quite quickly and efficiently. And people are willing to pay for that. People are willing to pay for convenience and speed and access of medication and healthcare.
Yeah, absolutely. And I think like ensuring that data privacy and security, you really want an e-prescribing solution that you can back and that you can be confident
Yeah,
in. Absolutely.
yeah.
So go on, sorry.
No, exactly. And I was going to say, especially when you have paper prescriptions around, they can be lost by patients. They can be lost in the post, especially if you're not sending it tracked, which you should be. Um, this adds that extra layer of data protection and privacy and security to prescriptions.
Yeah, absolutely. And I come from secondary care practice by background, so being a pharmacist there, and just the headaches of even within a hospital of being able to lose paper prescriptions. There's a lot of time
Yeah,
spent and a lot of risk. So that
yeah.
only
We
becomes
had,
more, I
I
think,
was
an
working in a
application.
pharmacy. I was working in a pharmacy and I had a case where being an actual pharmacist, a patient presents with a prescription and it looks perfectly genuine. Everything about it, the signature's there, the details are there. But actually, there was a WhatsApp group where I was informed that the same patient has gone to 4 or 5 different pharmacies and picked up the same script. So obviously, I knew it was a case because of that. But alarmingly, I wouldn't have known had it not been for a WhatsApp group that I happened to be part of. So it was left like chance rather than actual data that this script was fraudulent.
Yeah.
Um, Whereas with an e-prescription tool, obviously the goal is to stop that happening.
Absolutely. And on the second point there, so 63% we've got managing medication errors and interactions. It's funny you mention a WhatsApp group. I think we're all guilty in healthcare of using WhatsApp groups, but I'm a part of a group, a WhatsApp group that has pharmacists in. And basically, the WhatsApp group's been set up to read handwriting, so doctors' handwriting. And forgive me, please, if we've got doctors on the webinar today, but honestly, some prescriptions are written up, and I think your local pharmacist gets to know the clinicians in the area and the prescribers in the area, and can really just flow with their handwriting. But at times, it can be quite confusing and lead to major medication errors when the wrong medication is sent out just purely because someone's misread some handwriting. So we can't forget, even that simplest of things is still a problem these days when using paper
Yeah.
prescriptions.
And taking that a step further, it's not directly an error, but actually, like, there's a massive shortage of so many medications at the moment, mainly through what's going on. Like the UK has suffered through so many key medications that aren't in stock. It's about working with GPs and private practices to make sure that they're not prescribing drugs that are consistently out of stock at local pharmacies, breaking down that patient journey. So and we can touch on this later, but we as a pharmacy work with doctors to make sure that, I can see there's some dermatologists here, there's some orthopedics here, and we'll look at the key drugs that you guys prescribe, and we'll work with you to make sure that we have stock and you know what's going on in the wider market for things that you commonly prescribe.
Brilliant. Okay, I am going to head back to the PowerPoint that we have. So thank you very much to everyone that got involved with answering those questions there. Hopefully we'll have lots more questions from you all later on, so we can go through a little bit of a Q&A session. So for those of you that don't know me, my name's Rob and I'm head of operations here at Medibase. So I'm a pharmacist by background, and I currently manage operations. So that's everything from onboarding new clients with features and functionality in Medibase and through to business as usual engagements too. I've been at the company for around 5 years, so I've got to know the functionality pretty well, but also the people too. And it's great to see a few familiar faces here on the webinar today too. So I would also like to introduce Reese, who's a guest on our webinar today. So Reese is the founder of Signature RX and Signature Pharmacy, but Reese, I think you'll do a far better job of introducing yourself than I can. So I'll hand over to you to say a few words.
Perfect. Thanks, Rob. So my name's Reese, pharmacist by background also. And I know we're all here to talk about the integration with Medbase. I'm the CEO of Signature RX and Signature Pharmacy. And I kind of started Signature Pharmacy 8 years ago. While I was at university, I was getting bubble tea delivered in the mornings and just general things from Deliveroo delivered. But when I wanted something the most, medication, I had to walk to a local pharmacy and find access to healthcare. And you could see that the culture was becoming a lot more on demand. People wanted things more on demand, like consumables more on demand, access to specialists on demand. And that was kind of coming through with the rise of telemedicine back in 2016 as well. But pharmacy never followed through with that. So there's a massive breakdown there. And we launched Signature Pharmacy back in 2016 to help kind of build an on-demand pharmacy delivery service. And through the years, we realized that actually there's a lot more we can do to support healthcare providers and patients through building what we can summarize as DocuSign of e-prescriptions. It's like an e-prescription tool in the private space. And we'll kind of touch on how we do it and what we do throughout the webinar.
Great, thank you, Reese. And actually, can you maybe say a few words about, I know we'll talk about Signature RX later, but what brought you to found Signature RX?
Yeah, so our core business model was our pharmacy, which opened in 2016, and we launched Signature RX in 2021. If we looked at the stats, our goal was to help private prescribers and telemedicine prescribers manage their clinic workflow. And we typically found that, just looking at the data, only up to 20% of patients were ever coming through for delivery. And if you look at like the nature of some of these telemedicine consultations, they're because they're repeat prescriptions and the patient may not be home, but also more importantly, there may be antibiotics which the patient needs straight away. And if you looked at that journey and how it works, the prescribers are writing prescriptions and they could be located anywhere. You've got patients located around the country and a clinic office who may be somewhere else, like the prescriber might be working remotely. And organizing a paper trail from prescriber to clinic, keeping that auditable, and then going to the patient to make sure they can pick up at a local pharmacy broke that journey down. So I think we tried to create this seamless journey for the patient, which is built all around the patient, where the patient can choose if they want delivery or collection around their schedule, but also streamline that properly for the practice for 100% of prescriptions, rather than just a small percentage that wanted delivery.
Nice, amazing. Okay. As part of the webinar, we just wanted to give you a quick background and information about Medibase, but also Signature RX. So just to let you know, so here at Medibase, we are an electronic healthcare record company. We work across the practice management and occupational health sectors. I know we've got a couple of our clients joining today. In terms of features in Medibase, we have features all the way through from booking to billing to communications and clinical management of medical histories and data in general. But in the last year, just to give you a couple of statistics, we've facilitated, over 2 million appointment bookings, almost 1 million payments in the system. We've sent a fair few SMS too. But the main factor I would say about Medibase is that we are a solution that encompasses all of this functionality into one place. And I'm hoping that you'll see a bit more about that later on. This feature that we're talking about today is no different to the rest in that it's integrated within the system. And that's one of the kind of unique points I would say about this functionality. There'll be some links at the end too. So if you're new to Medibase, please reach out to us. We're more than happy to have a conversation around the functionality and how that might be able to help you. Over to Reese to talk a little bit about Signature RX.
So Signature RX is a private e-prescription solution. It complies with the Human Medicine Regulation 2012. So at the point of creating a prescription, we generate what's called an advanced electronic prescription or advanced electronic signature. We currently issue 50,000 prescriptions a month through our system. Over 30,000 scripts a month are dispensed across community pharmacies nationwide. And that includes Northern Ireland, Wales, Scotland, all across England. And that's dispensed across a network of 6,000 physical branches, which makes us one of the largest, actually makes us the largest private e-prescription provider in the UK, just by reach and well known. And I actually had a script the other day from Signature RX, and it's the first time I used it in 2 years. I walk into a local Boots pharmacy, and it was amazing to see how the pharmacist, the person at the counter, immediately knew who we were. They knew what website to access, and they took the prescription code, mainly because they're so used to patients walking into the pharmacy and seeing, that journey on their side is really easy as well.
Brilliant. And today we're here to talk to you about medication delivery and collection. So we really see this as a game changer for both clinicians and patients. And as you know, we've given you a little bit of background already, I think, to some of the benefits of it, but also to both Signature RX and Medibase and how we're coming together with this partnership and integration. But a really interesting quote that we had recently from one of our private GP clients was that it just worked brilliantly for them, just like Amazon Prime. And I think this is quite a key piece. Previously, Reese, you've used that comparison of delivery orders, but we do truly live in that on-demand kind of society now and lifestyle. And I think this is no different. I think that this does really bring to our clients at Medibase the ability to provide patients that on-demand service with their healthcare that I know they truly want.
Yeah, and patients consumers in general look for 7-day a week, get it as quickly as you can, free delivery. So we look at I looked at what I expect as a consumer and what other people also expect as consumers, and we built a service that we think that consumers expect, that's up to date with modern e-commerce solutions and things like that. So, if you order in the morning and you're based in London, at no extra cost, a free delivery, you can have your medication delivered to your office in the afternoon. If you order in the afternoon and you live in London in the evenings, your medication will be delivered to you at home in the evening as well. 7 days a week, all completely free delivery.
Great. And just to elaborate on that, so a couple of benefits that we wanted to bring to talk about on the webinar today. So 6 here, so talking about simplifying the entire prescription process for organizations. Again, so Reese has mentioned the legislation here that we're fully compliant with and the solution, that peace of mind that what we're doing here is compliant, because there are lots of e-prescription processes out there, I'd say, that verge on not truly being compliant and still requiring that wet paper, like signed prescriptions, which this solution doesn't require. So this is fully compliant. The e-prescription complies with the legislation, meaning there's no need for that follow-up prescription. Brings me on to the next point. So it's removing that admin headache of needing to follow up signatures by post or by fax. It really reduces that patient stress. It allows patients to receive their medication in the most convenient way to them. So Reese has mentioned being able to have medication delivered to maybe a work address or a home address or a temporary address. We facilitate that through this functionality, which we can come to a little later. We've also got benefits for the clinician. In the end, clinicians can hopefully spend less time on admin, more time on caring for patients. It might free them up for other tasks, for example, as they're able to, with one click, prescribe, e-prescribe through Medibase. It provides a new and highly sought after service. So again, buying into that kind of more on-demand approach, it gives the patient that flexibility, but provides a modern service. And then I think most important for myself, and I think I can speak for Reese too from previous discussions we've had, but being able to commence treatment with the shortest possible timescales. So things like antibiotics, being able to prescribe them, they can be through a telemedicine consultation with a patient or even in person, but it allows the patient to go to their nearest community pharmacy, pick up the medication there and then within minutes from a consultation, or if they choose, they can have that medication delivered too.
Yeah, and that's really important. There are other online pharmacy providers out there. And the difference with us is we look at the patient journey. We look at what the patient wants to do. If they want to pick it up one day, if they need to get their next prescription delivered, we can work with the patient based on what their needs are at that moment. And in turn, that benefits a practice. If you look at general prescriptions through another pharmacy provider or even through us, you'll see an uptake of about 20%, where the clinic then has to deal with the rest of the 80%. Whereas through Signature RX and Signature Pharmacy together, we can help you streamline 100% of all of your prescription fulfillment requirements.
Fantastic. So we thought we would actually speak a little bit about client success stories to illustrate the benefits that we've discussed so far. So I think, Reese, I'll hand over to you to talk through this first one.
Yeah, so we have a range of clients going from smaller one-person practice clinics or one doctor going around seeing patients, to smaller clinics, 4 or 5 people, to even larger telemedicine companies. And one of our telemedicine companies that uses us saved about £500,000 issuing 10,000 scripts a month. The previous process would involve remote working doctors, prescriptions being signed by the doctor remotely into a head office. Maybe a doctor at the head office would countersign or sign it there if the doctor was working in practice. And then a telephone support team calling local pharmacies, seeing if they've got the item in stock and then posting it. So the annual saving just looks at the time, the cost of stamps and organizing everything, but it doesn't even look at the improvement in patient journey and the patient outcomes and satisfaction, because that would be significantly improved. Sending a patient the code and giving them the freedom and empowering them to choose where they want their prescription and when they want it. One of the key benefits of this is a patient can walk into a local pharmacy. If they've got stock and they're happy with the price, they can pick it up straight away. If they want to walk in next door, they can without having to switch anything and without the admin burden of it. In our delivery service, we did an audit on our delivery service recently, and patients who chose our service across the country received their prescription in 1 day and 8 hours. That's 7 days a week in London, nationwide, and that includes the weekends as well. So we didn't just exclude weekends. That is, if you order on a Sunday, you will still get it delivered on the Sunday or the Monday, depending on where you are. So we make a massive impact to larger services. But the key thing here as well is even if you've got a smaller practice, it still makes a huge impact because, we've got smaller practices that have to employ a single admin staff just to manage prescriptions. With our service, you wouldn't need to.
Amazing. And I just wanted to select, so we've got quite a large enterprise client who interestingly was using an e-prescribe solution, but moved over to using this e-prescribe solution. And they had a monthly volume of around nearly 2,500 prescription appointments. But their main challenge was handling this high volume of appointments safely and efficiently. So speaking again to what Reese has said around paper processes and the need to maybe even have an admin member of staff handle things like following up with a paper prescription to a supply. In this scenario, the solution was fully compliant, so the existing solution that this client had. However, it required logging into another platform, and it didn't send all of the details from Medibase automatically and for that prescription to be fulfilled and delivered to the patient. So it actually required the clinician to enter the prescription again into another system. And this was taking considerable time in the consultation away from the clinician and the patient. And it saved around 3.5 minutes per consultation once the client started using our feature. So that might not sound like too much, but that is around 8,500 minutes saved. So that's more than 141 hours of clinician time saved per month, which is an incredible figure for us to have and something we're very proud of. More importantly, we must speak to the safety improvements here. So when we've got clinicians that are jumping into systems and copying over prescriptions, there's room for error. After all, we're all human. And what we're doing here through this solution is automating that transfer of information straight from Medibase over to Signature RX with no manual intervention, so limiting that and mitigating that clinical risk. I use that that WhatsApp group example of not being able to read a clinician's handwriting. Of course, that's not really applicable here, but easily a wrong medication could be selected when a clinician transcribes the prescription into another system, and we're removing that piece. Of course, we're providing operational efficiency here, so that admin time and that 3.5 minutes or the 141 hours can now be used on providing other services and critical pieces for patients. So before we jump in and do a demo, I'd just like to walk through a piece here around the flow. So here we've got the medication delivery and collection feature within Medibase. Once the e-prescription is signed in Medibase, the clinician will select whether this is going for delivery or for collection. If it goes for delivery, it will go over to Signature Pharmacy, and the patient will arrange payments via an SMS link for that. And once it's paid, then Signature Pharmacy will dispense the medication and send it to the address that the patient chooses. And we'll see that a little later on. And then we've got the collection route. So with the collection route, this means the patient can go on and can collect their medication from any local pharmacy. And they can also opt, if they change their minds, to go to have the medication delivered. And again, we'll be seeing that a little later on. I am now going to jump into Medibase and show you, hopefully, the signing of the prescription and what that looks like. So I'm going to log in here to a demo environment to a patient that I had set up earlier. And the key piece that I'd like to point out here is that the signing of the prescription is no different to the signing of a prescription without this feature. So when we go to prescribe here, I'll be prescribing some amoxicillin, for example. But we go ahead and we find our amoxicillin and we go ahead and prescribe this, accepting any clinical decision support warnings, although this patient doesn't have any allergies or other medication. So here I can put that this patient will have 1 capsule every 8 hours, and I'll give it 21 capsules as the quantity. So this is the usual process for signing a prescription, except you'll notice that there is this Save and e-prescribe button here at the bottom of this pop-up dialog. If I click this here, what it will do is it will take me to another screen to send the electronic prescription. At this point, it pulls key pieces of information from the patient records, such as the name, the date of birth, gender, and also email address and mobile number. I can toggle here a different address. So for example, I can add an other address or a billing address. So again, speaking to that convenience for the patient for delivery, I can change that address so that Signature Pharmacy can fulfill the medication and dispense it to the most convenient location for the patient. I then select either collection or delivery. What I'm going to do in this scenario is select collection. So the expectation is that the patient's going to go to their local pharmacy to collect the medication. You'll notice what I'm not doing here is selecting a pharmacy for the patient to go to and collect the prescription from. And we can come to that a little bit later, but what I'd say is there's no need for that at this point. We empower the patient to go to the pharmacy of their choosing, and Reese will explain that. What I will need to do is just consent here. So with open dialogue with the patient, confirm that they're happy for us to be sharing this data with the e-prescribing pharmacy, that's Signature Pharmacy, and also consenting to email and SMS updates. Now, I think we actually had, if I saw correctly, we had a question in the chat around CDs. And just to be very clear, we don't support controlled drugs Schedule 2 and Schedule 3 through this functionality. We support all prescriptions other than that. And we've got that as just as a disclaimer here at the bottom. That does mean you can still get these prescriptions fulfilled with Signature Pharmacy, and I'm sure Reese will explain later, but that will require an FP10 CD script as per UK legislation. So I'll go ahead as a clinician.
Just to click on Rob, I think Zopiclone and those Schedule 4s are accepted, aren't they? Yeah.
Yeah, absolutely. It's just Schedule 2 and Schedule 3s. So as a clinician here, I'll be checking all of the details on the prescription before sending that off. I can see here that the status is not sent. So at this point, it has not been sent to Signature. As I click sign here, I will be asked if I'm sure to e-prescribe, if I want to e-prescribe this. By clicking OK, this will now be sent over to Signature, and I will get this confirmation dialog here. So the e-prescription was successful in being sent. Click OK, and I can see in today's prescription I've got amoxicillin, and this is what today's prescriptions, as many of you will know, is the usual functionality and area that we saw the prescriptions in Medibase against the consultation. Here you can see this has been e-prescribed, and you can see it's got a status of open, meaning that it's been sent but not dispensed by Signature. I've also got a unique signature ID here, which you'll be seeing through this demo. But that is how you would sign the prescription within Medibase. Please, at any point, if there's any questions, do ping them into the chat. We're having a look here at the comments, so we'll answer them as we go. If not, we'll keep them towards the end. So at this point, sorry, Reese.
Yeah, I was going to say, so in the background, once the script's been sent from Medbase over through to Signature RX, we will e-sign that prescription. So we use what we kind of like get all that data together, encrypt it, and send it through to a blockchain. That will basically mean it's part of the regulation. We need to prove that that prescription can't be changed or altered in any capacity. And that's what we do. We make sure that the prescription is generated and that there's no changes to it and it's completely secure end to end. So the patient can't come in and start changing the outcome of what they're prescribed. It's completely secure and auditable throughout the whole process. From the patient side of things, they're going to get an email and an SMS straight away after you've issued that with a prescription ID code, and it's a video playing.
Yep,
If you can run the video,
through.
they will get a prescription ID code, and the most important part, the thing that we're most proud of, is a phone number to contact us 7 days a week. And I'll show you that phone number now.
It doesn't seem to be playing.
That's fine. I can answer Kathy's question in the meantime, Rob, if that's okay.
Yeah, of course.
Yeah, amazing, Kathy. So the pharmacy is Signature Pharmacy. It's our own in-house pharmacy. The good thing with that is you have like a really flexible way of contacting support. We kind of work really hand in hand to manage that whole journey end to end through our own support channels if the patient wants to pick up or get it delivered. And one of the key things we've looked at is pricing. We've looked at, how can we make it affordable to increase uptake? And if you look at, for example, something like amoxicillin from us, it's £10.20, including delivery and including the medication cost. That's delivered same day or next day, 7 days a week, as fast as we possibly can. And we're happy to go through with you if you've got any specific medications or pricing. We're completely transparent about it. We can provide you pricing up front and let you know how much that would be. But here's the email that the patient receives at the point of delivery or issuing for collection. And you'll see the phone number here straight on the email where they can contact us. We're open 7 days a week, 9 a.m. to 6 p.m. Monday to Friday. And that's a prescription ID they can use at local pharmacies. And we incorporate your branding in here as well. So you'll see your logo and your clinic name. If the patient wants delivery, they can click on that button saying deliver my prescription, and that will switch them straight to it. And we also have a user guide which a patient can access on demand with our support number on there as well. And just information for the patient on how they can pick up their prescriptions and what they need to do. But it's as simple as walking into a local pharmacy and saying, here's my Signature RX code, can I pick it up? When they want delivery, they would just enter the date of birth in there and submit that to Signature Pharmacy, who will then process the delivery on their side.
Brilliant.
Yes, good point. So Wegovy is actually one of us, just responding to Kathy's question here. Wegovy is one of our specialist areas. We have a few key areas that we focus on. We typically have good stock of Wegovy. We try to keep the prices as stable as possible. But I think if you just want to drop us an email, we can let you know availability. We can set you up as a clinic. We'll work with you to really manage that patient journey, because the last thing we ever want to do is for you to get a patient that comes in and starts on the strength of a drug, needs to titrate up or stay on the same dose and can't get access. I guess the key benefits for us is you have Signature RX as well. So as well as our own in-house pharmacy, you can use any prescription code that the patient can walk into a local pharmacy who also will have stock, and they can use the Boot stock locator online. And we're working really closely with local pharmacies, especially in the Wegovy space, to allow them to upload their real-time live stock. So your patients can kind of go on a portal and see real-time live stock of key medications like Wegovy and prices and make informed decisions. And also give clinicians an assurance that when they do prescribe through this system, that the stock is available either with Signature Pharmacy or at local pharmacies. And that process of collecting from a local pharmacy is really easy as well. If we go into the next demo, once a patient chooses delivery, they will get a text from our pharmacy. It will open up a single one-page checkout. And here's a convenience part. They can put in their postcode. So it could be a work address, it could be a home address. They select from a drop-down where that is. The delivery options that are available to them based on their address shows to them. So over here, you've got the same day address, and they can pay for it through Apple Pay or using a saved card. So, I think it was probably about 5 or 6 clicks. I've just checked out for my prescription. And we can work really closely with clinics who can say to us, we want to cover the cost of medication on behalf of the patient. Um, can you invoice us and just let the patient check out? And we can do that too. We can invoice clinics and the patient will just check out with their delivery details and see no cost or price at the point of checkout. Um, and that was how easy it is. And the patient throughout the whole journey can see when it's been ordered, when it's been dispatched, when it's been shipped and completed. And we're quite obsessed with tracking and keeping the patient feeling comfortable where their order is. And we're going to be adding new features like showing what clinical pharmacist has checked their prescriptions and what stage of the dispensing journey it is. And on our side, we even log the batches of every single drug that we've given against an order. So if there's an MHRA recall, we can see exactly what batch we gave to what customer and recall that in the most effective way possible. Touch wood has never happened, but we have the safety and assurance to do that.
Brilliant. And just to circle back on Medibase, I know Kathy, you had a question around prescribing error. So what happens in that scenario? So what we have in Medibase is a two-way flow. So the statuses that are updated. So when Signature Pharmacy or local pharmacy dispense the medication, the status that I showed on screen within Medibase will be updated. So you can see here a couple of statuses. There's 7 in total. We've got things like open, expired, voided. So for example, if a clinician cancelled one of those prescriptions, then it would no longer be able to be fulfilled by either a local pharmacy or Signature pharmacy. And then we've got things like delivered and shipped as well.
And if I can just jump in, Rob, like
Of
I think
course.
Louise asked a question as well about shortages, and it kind of touches on Kathy's question too, if there's a clinical issue. The patient will see, the patient will go into a pharmacy, the pharmacy will always clinically check something, and things do happen. A prescriber may accidentally write the wrong drug, or maybe a bit uncertain on, I think a common one we see is Wegovy, they write 4 rather than 1, because it's 1 pen for 4 weeks, and they would write 4 thinking it's, for 4 weeks of treatment. Small things like that do happen. The pharmacist has the number of the clinic, they have the email address of the clinic, and they can reach out at any point to the clinic or the contact details you've provided to contact them. And if ever that's happened, or if ever there's a shortage of medication that you can't resolve, you can void a prescription, stop the patient ever picking that up again, and then you can just reissue it immediately wherever that patient is. They'll get a text within a couple of seconds and they can get that new script straight away.
And is it worth talking about, Reese, like the service, I suppose, you provide to patients themselves? So at the point of signature, if one of our clients sign the prescription in Medibase, that's transferred over to your either Signature Pharmacy or Signature RX. But what service do you provide and counselling for patients?
Yeah, so we as a pharmacy will clinically check the medication, we'll make sure it's delivered safely. Patients can call us if they want to as well, speak to a pharmacist whenever they want during opening hours. And we as a pharmacy can help them and support them wherever they need to. We also work really closely with clinics to monitor stock, to monitor shortages, to work on what they're looking for as a clinic. And I think the key question that we ask is to clinics is, what's your ideal patient journey? How would you want that to look? And let's make that happen. And that's what we can really do with this. Similarly, with patients, they've got access to our concierge service. So there's times where drugs aren't in stock, and elderly patients, especially who may need a bit more support, they can call our support team. We can call a local pharmacy up and say, hey, Mr. A or Mrs. B is going to be presenting at your pharmacy shortly. Here's their prescription details. Can you get it ready, or do you have it in stock? And we can really help coordinate the end-to-end process based on what the patient wants.
Brilliant. And do you find that, I think we're open for questions, but one last one from me, I suppose. When you're working with our clinics, do you find any benefits of having that more kind of closer relationship one-to-one, because you're after all one pharmacy rather than many that a clinic might have to deal with?
Yeah, exactly. We really work closely with clinics to find out exactly what their needs are, what drugs they prescribe, what they typically look for in a pharmacy process. And we kind of map that out. And what we kind of do is if a clinic approaches us and says, hey, look, this is the type of clinic we have, these are the services we have. We'd look at the current journey, we'd look at how we can improve it. We can have regular catch-up calls to make sure that that journey is working, but also look at that on a patient level as well. So we can go down to every single patient, look at every journey and make sure that it's streamlined every time. Um, we have clinics that would email in, and we keep that dialogue open and friendly with clinics. Anyone from the clinic can contact us. There's one or two points of contact throughout the whole journey, so you're not getting lost in a process. We really help support those clinics, and I think one thing we specialize in, especially moving as we've done this ourselves, going from a small company as we've transitioned to growth, we really work with clinics who start off something and are really looking to grow because we know that journey. We know what larger clinics want, we know what smaller clinics want, and we can kind of work with you to tailor a solution for you.
Great. Fabulous. So we've got a couple of questions in the chat. I'm going to bring some up, Reese. I think you'll be best placed to answer them with regard to the pharmacy service. But I'll bring up one here from Georgia around payment.
Yeah. Yes. So Georgia, payment for delivery is through the link. We're looking at working more closely with local pharmacies. So potentially, a patient can, again, using the same integration, pay for a prescription at a local pharmacy, and then by the time they walk in, it's ready to collect. So that is something we'll be looking to build out, but also the delivery side of things, the patient can see the price online, pay for it online, and then they'll see a delivery estimate as well, and we'll deliver it at the same time. And that comes through Signature Pharmacy for that payment.
Brilliant. Thanks, Reese. I'll bring up another question here. So got a question around collection. So yeah, and if there's an ability to pick collection from a specific local pharmacy.
Yeah, there's nothing stopping that. I mean, if you look at Robert, during the demo, you showed a signature RX code. You can get that signature RX code, copy it, send it straight to the local pharmacy using their contact details, and they will have it straight away. Or the patient using their email can walk into that local pharmacy as well and pick it up. So we don't want to ever hinder relationship with local pharmacies. Our goal is to enhance them. We know loads of clinics actually do have local pharmacy partnerships they work with quite frequently, and their current process involves printing, hand signing, handing over these paper scripts to local pharmacies. Our goal is to still streamline that, and we can help you with that as well.
Yeah, and what I would say is that even recently with a client of ours, Reese has done a great job in trying to map out that unique process for that clinic. So together we've managed to put a workflow in place that serves a specific pharmacy and that leverages some of the functionality you saw today, but also brings in some bespokeness to meet that client's requirements. I'm going to bring up a question here from Claire around the Schedule 2 and Schedule 3 control drugs.
Yeah, this is a really big thing at the moment, especially more and more as ADHD clinics, mental health clinics, and there's a lot more awareness of it in the market, and the rise of this kind of prescribing is becoming a lot more common. At the moment, e-prescribing, just because of legislation, isn't available for that. Personal opinion, I think it needs to change. Having like pink FP10 CD prescriptions being transmitted across the country, and even the NHS backlog, like, do they have the capacity to take all that on and scan all the prescriptions they have in? It's not as auditable as something electronic could be. So yes, we are trying to work with that. I don't see it being a quick process, but we are trying to work with it. But we, as a pharmacy, also know the process is quite difficult. So we've got loads of things that we can do to support clinics on that situation. So we have collections and track collections where we can kind of pick up FP10 CDs from you and bring them into our pharmacy and deliver them to the patient in 24 hours. So if you do have a clinic that does prescribe a lot of Schedule 2s and 3s, we can still help you and support you by picking these things up from prescribers that could be in practice or remote, helping you audit them, helping you run reports on them, and we can support that from Signature Pharmacy side. And then the Medbase integration can really help with the other things like the atomoxetine, if it's an ADHD clinic, the atomoxetines or the antidepressant drugs that don't need CD prescribing.
Yeah, it's a question that we get a lot from clients actually around Schedule 2s and 3s. And unfortunately, that legislation's there for prescribing on FP10 CD scripts on paper, which hopefully one day we'll be able to replace with a solution like this.
Yeah.
Thank you, Claire, for that question. I'll move on to just bring up Kathy's question here around delivery and what happens if the patient's not home, for example.
Yeah, so you probably saw during the checkout option, the patient can see their delivery date. They can see the different delivery options, so they pick something based on what they want. So if they know that they're going to be home today and they've got same day available to them, they can pick same day. They can even pick a courier based around their schedule. They can arrange re-deliveries. If they pick DPD, they can swap that over to a work address. So there's loads of options available to them to be either pick up from a local place. They can either re-deliver it. They can reroute it halfway through if it's DPD because there's in-flight options, and same with Royal Mail as well. So we do a lot, as much as we can, to support re-delivery and access to that delivery as well.
Fabulous, thank you. And Kathy, you had another question there around cost. So we haven't covered cost here as part of the webinar. However, our new product solutions do include this feature, and there is a small cost associated to it. But please do get in contact with us. We do all sorts with our clients, including like giving discounts for the feature based on your volume of usage. But what we'd like to understand is your use case first and foremost. We've got a question here from Chris around prescribing or sending prescriptions directly to a pharmacy.
Yeah, so it touched on what we said earlier about the client that had a specific use case of only using one pharmacy. We definitely can do it. So if you know, Chris, that you want to send a prescription to the same pharmacy every time, get in touch with either Rob or myself when you're your account manager for Medbase, and we can work with you to streamline that process. So you would issue the prescription in Medbase, and it will seamlessly not contact the patient, but send it straight to that local pharmacy of your choice. And it'll be native integration again, straight from the Medbase platform. If you want to do it another way, again, you can use the signature X code that's generated on response when you send it to us, and you can email it to that pharmacy more manually if it's a different pharmacy every time. So we always can work with you to make that option work, just depending on your use case and what you're using it for.
Yeah, absolutely. And it's brilliant that we're able to offer that. I think that's a real unique aspect to our partnership, that we've been able to not only provide this kind of standard functionality that you've seen today, but then go one step above that, I suppose, and go the extra mile for that bespoke workflow.
Yeah. Yeah, I think that kind of sums up everything we do. It looks at every clinic, every demand, and how we can make it work for them. And I think together we definitely have shown that we can do it.
Great. I think that is all of the questions that we've had. If there's any last minute questions, please do add them there on the chat. So we've actually got a last question here from Lewis. So do we deal with vaccines and cold chain delivery of them?
Yes, we do. So with everything we do in our pharmacy, if it needs cold chain, we're going to send it out cold chain. And again, with vaccines, we can work with you. You can issue that prescription. You can let us know to invoice the clinic for it. We'll invoice the clinic, and then we can deliver to the clinic the vaccine order for the patients as well, if the patient's getting it in clinic. So we definitely can work with you to streamline that process of vaccines, and it's all delivered cold chain through our couriers.
Fantastic. So I think that if that's the last of the questions, I want to say thank you very much to everyone who's joined us today on the webinar, and thank you, Reese, as well, for joining and speaking through the functionality and the brilliant service that you provide, both through Signature RX and Signature Pharmacy.
Thanks, Rob.
I've just popped our contact details there. We'll send around a recording of this and also some collateral, so other little pieces like leaflets, etc. If any of you are interested in discussing this feature further with either Reese or myself, we'll send our contact details around too. I've taken a couple of names down, so Chris and Kathy, I think there was some follow-up there to your questions, so we'll be sure to be in touch. But it was fantastic to see you all, and thanks again for joining.
Thank you so much, everyone. Thanks, Rob.
Thanks. Bye bye.
See you.